We're back for another exciting episode of Horse Plus Podcast, and I'm here with Dr. Lydia today, who's been our shelter veterinarian for how long now? Off and on?
I've worked part-time for Horse Plus since 2015, but came on board full-time in January of 2024.
Awesome. What kind of prompted you to come work here full-time?
Oh, man.
I know you don't want to talk about your previous job too much, but...
I love Horse Plus. I love the work environment. I love equine medicine. And Tanya and Jason have been awesome to work for. And they really made me an offer I couldn't refuse because they kind of gave me everything that I asked for. But two big, huge things for me were I don't have to be on call. I was available for emergency coverage basically every day of the year for 10 straight years. I was really tired of getting up at 1 a.m. and running in for emergencies. And also, they expanded our vet department and they hired Dr. Gina as an intern, but she was crazy overqualified to be an intern. So I love having a colleague. And it was a lot of factors. I also believe in calling and God's timing, and it's just like all the doors opened at the same time. So
awesome. So how's your experience been working here at Horse Plus? I mean, there's cameras, there's light, there's action, there's healthy horses, there's sick horses, usually, unfortunately. There's dogs, there's cats, there's all kinds of things.
Yeah. I love this job because I am passionate about helping animals and also about educating people. And so I don't love being on camera. I'm very awkward on camera. But I've learned to just kind of not notice it. And in fact, sometimes I literally run into our media team like, oh, I didn't notice that you were right in my face, because I've just gotten used to tuning it out and kind of doing my job. So if it seems like I'm ignoring our media team, I usually am. I love the variety of medical cases that we see here, and I love some of the crazy things that we see, even though we're not able to save a lot of the animals that we see with these crazy things. I've seen more in the last year and a half here at Horse Plus with equines that I've seen in the last 10 years being in private practice. So it's pretty cool. It's never boring. It's really never boring. The hardest part about this job is that we get animals that have been treated so unfairly by humans. And it's a really heavy burden to bear with these horses that so desperately want kindness and they connect with you. And some of them have very little time left. But it's so rewarding to just stuff the cookies. Yeah. I got reprimanded today by Lynn for mentioning that I liked a specific kind of horse treat, because apparently now we have a lot of them, but I'm happy about it. I'm going to feed them to all the horses.
Good.
So I love it. I've been really, really thankful to work here.
So what are some of, you mentioned you see a lot of different things. What's some of the more extreme things that you've seen here that you're like, probably somebody in private practice may see it once in their career?
Oh man. Both illnesses and injuries. Uh-huh. I think that almost every month we have horses come in with some pretty catastrophic fractures. I have never seen the degree and severity of the fractures that we see. And then also, heartbreakingly, we see horses that broke their leg 7 months ago and have been painful for 7 months. And it's horrific to see. It's very rewarding to give those animals pain medication and watch them relax for the first time in forever. My very favorite are laceration repairs. I love a big gnarly wound, and granulation tissue is something that we see in horses, but like as a private practice, I think the biggest proud flesh I ever removed was like maybe that big. And here we've done like huge ones that were successful. So that's really rewarding. Obviously we really want everything to go on to adoption. Another case that I really enjoyed was Dora, that big, huge draft mare that had the tracheostomy in place that we were able to fix. And Dora's doing great. She was adopted out. But I love those cases. And like, I didn't even see a single tracheostomy case the whole time I was in vet school or working at a teaching hospital or referral hospital. So wow. I could go on, but I would use up the whole time.
So as far as diseases, I know we've been getting diseases that may have been around for a while, but we just weren't testing for them. How did that start happening, and what diseases are these?
Oh man, I don't have enough time to talk about all the diseases that we've documented. And actually, to go back a tiny bit. So my previous job, I worked at an organization that managed the index herd for elephants with tuberculosis. So I love zoonotic disease and infectious disease, especially bacteria. So when I came here, I was like, well, that part of my career is probably kind of over because like we see the same things in horses all the time. And I was wrong. Very recently, we've had not one, not two, but 3 cases of equine diphtheria. So I had to Google it because I didn't learn anything about diphtheria. It's the D in the DPT vaccine. So America started vaccination efforts like 1920s through 1940s. So we almost don't see it anymore. And it's extremely rarely documented in horses, even though they used horse blood and horse things to develop the vaccine itself, which makes it confusing because if you Google horse diphtheria, you come up with a bunch of vaccine history. So we're working with human health experts to try to figure out why we're seeing that. But the reason why we're finding those is because Dr. Gina and I, with amazing support from the Cord Animal Health Diagnostic Lab in Nashville, they pro bono do a huge range of diagnostic tests for us. So we're incredibly grateful. I just sent our invoice to our financial person, and it was like 3 pages of tests, and all of them were $0. So they're incredible. We're really grateful for them. And as a nonprofit, we wouldn't be able to justify spending that much on diagnostics. But what we're finding are that the horses that are coming through aren't just sick. There's some of them are sick with 8 or 9 different bacteria. And I say bacteria specifically because we're not screening for a bunch of viral diseases or fungal diseases. We're kind of only looking for the bacteria. So I've got pages and pages of spreadsheets documenting that. Almost as concerning, maybe to more concerning, are the patterns of antimicrobial resistance. So, which is layman's terms? Antibiotic resistant strains. And that matters. I don't care who you are. Antibiotics not working on bacteria anymore is a problem that every single human on the planet should care about because,
basically could put us back before we had antibiotics.
Exactly.
People dying from simple wounds.
Yeah, we have thousands and thousands of diseases out there that are like, no big deal, just, take some penicillin or whatever else it is, that we can't use those same drugs anymore. And the rate of antimicrobial resistance, the rate that these superbugs are becoming resistant is far outpacing any development of new antibiotics.
So how does an animal get an antibiotic resistant disease or bacteria infection?
I don't have the time or expertise, I think, to answer that fully accurately. But in a super oversimplification, antibiotic resistance happens when a population of bacteria are exposed to a drug that doesn't kill them all. So whether it's the wrong antibiotic or the wrong dose of an antibiotic or the wrong method of administration.
Or they didn't do it long enough.
Yes, exactly. Right. When your doctor says, take all the pills in the bottle, what they're trying to do is keep the most strong bacteria from surviving. Because what happens when you kill all the weak ones off is the ones that survive are worse than the whole population was to begin with.
So that's important.
It is really important. And I don't want to speculate, right? But I'll speculate a little bit that there are a lot of antibiotics that are kind of available either by somebody not treating them appropriately, or you used to be able to buy LA200 is oxytetracycline or penicillin. You used to be able to buy those at Co-op or Tractor Supply and Hohenwald. You can't anymore. The reason why we've designed some classes of drugs as prescription only is because if we're not careful with how we use those and we don't use them appropriately, we can make things worse. I'm surprised that was the first time I've touched this. I talk with my hands a lot.
So this is a real concern because if some of these diseases get to be antibiotic resistant, and then especially if they transfer over to food animals or they transfer to people, this is going to be a real concern.
Yeah, it already is a concern. Antibiotic resistance is a re-emerging public health threat, and it's being tracked and monitored. And I think obviously I love animals, but I feel almost more pressure, I feel like, as a veterinarian than human doctors must feel, right? Because if I'm a medical doctor and I'm treating an 8-year-old kid, that kid is the most important thing, in the moment, right? Yeah. But if I'm a veterinarian and I'm treating a herd of goats, I want those goats to survive, but I have to recognize that human life and our ability to preserve, human public health is also really important. So I have to take both of those things into consideration. And the way we get around that is with diagnostics. So one of the really cool things about this lab is they're not just telling us what bacteria there are. They're telling us where the resistances are and which drugs are appropriate to treat that patient. So if Dr. Gina and I do have to use antibiotics, which we do all the time, we always do it in an informed manner. Like, yep, this drug at this dose, based on what we know, is going to effectively treat this patient and not create more resistance.
Oh, that is most excellent. It was pounded into my head watching Tawny give this presentation over and over and over up in the hill. 3 out of 4 new human diseases come from animals.
Exactly. Yeah.
And that's CDC.
It's actually greater than 75%.
That is crazy.
Yeah.
Like, wow. So transitioning a little from your professional life, I know people see you on the film all the time because you're kind of the one that processes verbally. Dr. Gina processes intellectually.
Nice I never stop talking.
Anyway, your family life, I understand there's some changes coming up in the future.
Yeah.
Well, maybe let's go back a little bit. Why are you working part-time this year?
Yeah. And I already talked about this on camera at one point, but I have 4 kids. I have 2 girls and 2 boys, 15, 12, 8, and 5. And we struggled a little bit to find an effective school situation for our family. And so I ended up in January of this year pulling back to working part-time, which is super big change for me. And I'm homeschooling my 4 kids and I'm horrible at it. I'm so thankful to be with my kids more, but it's a tough job. Being an at-home parent is the hardest job in the world. So I'm only working 2 days a week instead of 4 days a week at Horse Plus, which isn't enough for me for what I want to do, but I'm so thankful. And then on top of that, so my husband and I are actually both missionary kids. Okay. We are Christians. Our faith is very important to us. And we both spent a lot of our formative years in Japan. And Japan is the second largest unreached people group for Christ in the whole world. Bangladesh is number 1, Japan is number 2. So less than half of 1% of Japanese people are Christians.
Wow.
So, and I hope I don't offend anybody by speaking about my faith at work, but this is a podcast. So, this is who I am.
This is who you are. This makes you.
So we have always felt called to missions, and we actually did missions work in Uganda and some other developing countries, and feels like the most normal place in the world for us would be to go somewhere remote and third world where we can use our degrees. My husband is an arborist. He runs a chainsaw all day, right? He can build anything. However, we both already speak Japanese. I speak it very poorly and my husband is fluent. But it takes, 3 or 4 years to get up to language competency, to have hard conversations about things like what happens to us after we die, and why are we here on Earth, and so we spent about the last 2 years applying to a missions organization, and we got accepted, and so we're not leaving immediately. We have to raise support. So the way our church works is we travel and we talk to people and we tell them what we're doing. And we raise enough to just cover our kind of basic living expenses. So I'm not leaving Horse Plus imminently. I'll probably be here for the next 1 to 2 years in a part-time capacity. But I'm partially heartbroken over leaving. I can't practice veterinary medicine in Japan because the exam is only offered in written Japanese. And if you've ever looked at kanji, it's very complicated. So speaking Japanese is one thing. Learning to write and then writing medical Japanese is like, probably if I studied for 10 years, I might be able to do it. So
I can't even imagine.
I think it's Japan's way of making sure that Japanese people are very loyal to Japan. So there really aren't a lot of professionals who can work in that capacity in Japan. So it's going to be a big change. We're moving to the most population dense city in the entire world.
Which is?
In Tokyo, probably.
Okay, Tokyo.
Yeah. We have to confirm where my husband and I are going on a vision trip / our 20th wedding anniversary trip in May. And we're looking at 3 different teams. So we'll know by then. But again, I'll be at Horse Plus for at least a year.
Let me get this straight. You're going from rural Hohenwald.
Yeah.
With, what do we have? 11, 12,000 people in the whole county.
Yeah.
To where I don't even know how many
think
people
there's
have a square mile. Like,
36 million people that live in Tokyo. And for reference, I always find this to be helpful. The entire country of Japan fits inside the state of California.
sure.
So it's pretty population dense. Yeah. It's a big change.
When you go there, like kind of what's the goal? Do you do something other than like, do you teach English as a second language? Like, I know a lot of missionaries will do that. They'll do health work. They'll do a lot of, John could run a chainsaw for him.
Yeah.
Like, do you have a physical way that you reach people?
Yeah. We don't know exactly yet.
Okay.
My husband and I are not sedentary persons. We are like super busy people. I actually taught at the Christian Academy of Japan before, many years ago. And we're hoping our kids can go to school there. And so I might teach in some capacity. There's supported missionaries and then there's vocational missionaries. So anywhere we've gone before, we've been vocational, which means we had a job and we shared our faith while working. Which we really explored. But what we ended up coming back to is it takes a lot of time to build relationship and to be available. And Japan is a very perfect country. Everybody's perfect. My family is a hot mess. I mean, we stand out. We are loud and my kids are always dirty and breaking stuff. And
which includes themselves.
Yeah, exactly. But I think in Japan, there's a lot of moralism, right? So people are very good people, but there's no grace, there's no forgiveness. And so the reason for being nice is very empty. And Japan also has the highest suicide rate of any country in the world. So it's a really, really tough place. We are going in our weakness. And we just hope to partner with an existing church there and practice discipleship and hospitality.
Nice.
And I'm absolutely confident that both of us will end up working at something in some capacity. But the purpose of raising support is we'll still be able to feed our kids, even if we're spending all day, hanging out with homeless people in the subway or something like that.
Oh, absolutely. So how long are you going to be there, do you think? Is
We don't know.
Okay.
We don't know. Probably not forever. We're not going to sell our farm here in Tennessee. So because we both lived there as kids, my husband especially was like, I don't really feel like I'm from anywhere. And when we first got married, he was like, if we ever have kids, I want a place that can feel like this is where I'm from.
Sure.
And that's Hohenwald for our family. So we definitely will come back. My parents are here. We lured them to Hohenwald and now we're leaving them.
Somebody has to take care of the place.
Yeah. So our initial commitment will likely be around 2 years.
Okay.
And we might come back at the end of that or we might not. We don't know. So sorry to not know, but
yeah, I'm sure you would have a place here when you come back. Just
awesome.
Walk through the door and let us know you're ready.
I'm just going to walk in and neuter some cats without permission.
So you'd be able to keep up on all your CEUs and everything.
Yeah, I'm going to maintain my license. Yeah. There are some states that allow veterinarians to work remotely, which sounds really awful to me because I'm the doer. Like I'm not the, so I will have that ability and I will maintain my licensure and everything like that. But I won't be able to do a lot of the hands-on stuff. So I'm going to cry thinking about it.
So I'm just curious, in Japan, can you at least treat your own animals or?
No, I don't think so.
Interesting.
No, Japan is very first world. So a lot of people hear Japan and they're like, they speak Chinese. Like there's a lot of, but Japanese culture and Chinese culture are night and day.
Yeah.
Like China, they eat cats and dogs and it's like very still kind of developing world. Japan is very advanced medically. They're very advanced with public health. So no, sure. Could I at home? Yes. But could I access any medications there? No.
Interesting.
Yeah.
So your kids, you said your youngest was 5?
Yeah.
He's going to, if say you leave next year, he'll be maybe 6. He's going to have a huge portion of his childhood that's tied up in the Japanese culture. Yeah,
my kids are already studying Japanese, and my family still lives over there. So my sister and her husband have 4 kids, and they live in Tokyo, and my brother and his wife have 2 kids. My sister-in-law is Japanese, so I have a lot of family over there. So we're excited for my kids. It's a little bit less scary for them, I think, being like, we're going on the other side of the world. But interestingly, my daughters have both been to Japan. Our boys, we spent the last decade paying off debt, just like every way we could so we could do this. Sure. And so our boys have never even been on an airplane. I thought about going on Google Flights and being like, what's the cheapest airplane ride just to ride in an airplane?
From here to Miami, about $49.
Yeah, there you go. I know. I mean, my boys would love that. So we'll get them there sometime.
Yeah. No, that is absolutely amazing. And the thought of just giving up everything that you have here to go help people there is a thought that not a lot of people can probably wrap their head around.
We've had a lot of well-meaning advice givers who have been like, are you insane? So I'm 42. My husband's also 42. And we are in the period of our careers where most people build wealth. You know, like my husband runs his own business. It's very successful. I just finally paid off massive amounts of debt. And so like this is the next 2 decades are normally when people are like, I'm going to like pad my portfolio. And we really prayed about it. And we want our kids to see a life of faith and not just have us tell them that it's important to trust that God will provide and to follow calling if God clearly calls you to do something. So it is a bit crazy and hopefully not too irresponsible. But it is exciting. And it is funny, people who don't have a faith keeping like, you're insane. I mean, like we're going to move into I'm sure a tiny, tiny house. My sister in Japan, this is kind of gross. Can I say something gross?
Yeah. So it's Dr. Lydia. Of course, she's going to say
house,
something gross.
Inside her house with all of the windows and doors closed, you can hear the neighbor brushing their teeth in their bathroom with their door. Like you can hear the toothbrushing. That's how close the houses are. So we're really fortunate right now. We live on a 30-acre farm and literally my 5-year-old walks around naked outside all the time and just does whatever he wants. So it's going to be a big adjustment for them, but they'll get there.
That is really exciting. Both you and your husband are able to follow your passion and your mission to go to Japan. And I do think your kids are probably going to be speaking better Japanese than you in about 3 months or maybe before you even get there. Who knows, right? YouTube will show it all to them and they'll be like, and you know, your husband can teach them well since you self-proclaim speak poorly. You mind saying something like maybe say hi to our viewers in Japanese if you don't mind?
Konnichiwa, watashi wa Lydia desu, hajimemashite. That's like, hi. My name's
that
Lydia.
pronunciation
nice
was perfect. I wouldn't know.
Thank you, Jason. Thank you so much.
So transitioning back to Horse Plus, though, when you did choose to come work here, I mean, that's a big leap of faith, is giving up a career that was paying just fine to work at a horse rescue, which also pays well. But
I didn't just give up another career. I gave up elephants, which is like...
Yeah, that would be hard.
Yeah, they're incredible. I worked with elephants for 10 years. But anyway, I'm sorry, I interrupted.
Oh, no, you're good. You're good. So what kind of sets Horse Plus apart? Like, why would you choose to come to work here?
There are so many things that I really appreciate about this organization. And I'll try to summarize them without getting too in the weeds. Horse Plus puts their money where their mouth is in that they don't just say, yep, we believe in using evidence to guide care, or we think veterinary care is important. Horse Plus shows that by enabling. And I don't know any other equine shelter vets that have a beautiful full service equine hospital. So that's pretty incredible. Before I was even offered this job, they were like, hey, we built a full service vet hospital and hey, you can do surgery inside with climate control. And then they were like, oh, you want some stocks? We're going to get some stocks. Literally pick out the best ones you want. Like this is before I was a staff veterinarian here. And then Tani and Jason had a hard time getting vets reliably to come out and take x-rays. So they purchased really nice digital radiograph equipment, huge improvement. The number of times people were like, can you just look at my animal and tell me what's wrong with it? And you're like, well, I can't see inside its body, right?
Yeah.
And then we asked for a better ultrasound and we got an incredible ultrasound. Tani, without us asking, got us in-house diagnostic equipment that I'd been asking my previous job for like 7 years. And these are things that like, these are not small amounts of money. Like a CBC machine costs like $11,000. You know, like this is not like, oh, I spent $100.
Right. But the cost savings through appropriate treatment, and not having to outsource all that diagnostic can pay for it over time.
Yeah. Well, I don't care about money. I just spend it, right? You should know that by now, Jason. What's different for me is the timely intervention. So on our buyout days, I don't have to look at a horse and go, wow, they look a little bit icteric, which is kind of yellow mucous membranes. Maybe they're in liver failure. let's pull a blood sample. We're going to spend a bunch of money and send it off, and we're going to get results back in 7 days. I can go, hey, can you go run this? And 10 minutes later, I can go, wow, we're in advanced liver failure. This horse is really suffering. It's probably nauseated. This has been going on a long time. And I know the prognosis is extremely poor. If I didn't have that diagnostic, or I had a facility that said, we really can't afford that, let's feed him some nutritional supplements and let's see how that happens. Yeah. Or if I don't have an x-ray, I looked at a horse today that just was a little off, owner surrender. And we took radiographs and found horrible mineralization all in the nuchal ligament. This mare is only 13 years old, but she was acting painful. And she had fractured multiple vertebrae in her back and had horrible mineralization that we couldn't see or feel on palpation. We just went, this mare is really kind of nasty about anybody touching near her withers, but she probably can't lay down comfortably. She probably can't roll over comfortably. That just happened. We just did that diagnostic and we immediately put her on some pain medication. Sure. But without an x-ray, we might've gone, maybe she had a bad saddle fit, you know?
Well, and sorry to interrupt you, but that is one thing.
I got in the weeds. You should interrupt
That is one thing that we really appreciate about being able to do these diagnostics is you have this horse, you put a saddle on and you try to ride her and she bucks and you're like, oh, this is a bad horse. She needs to be corrected and trained. No, she's in a lot of pain.
Exactly. And I think that is something, I think there are other organizations that don't know what we do that are critical of our euthanasia rates. But the reality of horses that get dumped for slaughter are, we don't get horses that have nothing wrong with them, usually, you know? And our philosophy is that until your body is healthy and your mind has had time to decompress, we're not going to chuck you out here and make you do training of anything that you don't want to do. And I really, really appreciate that. I have never once felt pressured into making any decision that wasn't fully in the best interest of the animal. And that's really important because they can't talk. You know, I took an oath to do no harm and to advocate for animals, and Horse Plus lets me do that. Not just with full support of the finances and the diagnostics, but also in private practice. And I love people. I work very well with clients. It is incredibly stressful to have an owner that has an agenda, you know, like, I don't care if it's going to make him lame in 3 years, numb him up so my kid can keep doing, you know, this sport for this horse. Or, you know, our puppy broke his leg. We don't have the money. We'll just get a new puppy. You know, like it is really tough as a vet to be put in situations where you can't make people do what they should be doing. And I don't have to do that at Horse Plus. I guess other than our viewers, right? Like in some ways, our viewers are the owners of these animals and we are accountable to them. Right. And if you've been watching the
number one, though, we're accountable to the animal.
Yes.
That is the number one.
That's why I'm here. And, you know, I mentioned that I don't even notice the cameras. I really kind of don't. Like, I just go practice veterinary medicine, do what needs to be done. And sometimes I forget to tell our media team. Sorry, Vince. I forgot this morning. This is why we have Nicole. But this job is very unique because very few animal rescues have invested in creating infrastructure and sustainability that enables them to do this. I think there are a lot of organizations that would love to have a staff veterinarian. I think there are very few organizations who have what it takes to maintain a staff veterinarian and to make them happy. I'm really happy in this job because Horse Plus has listened to me and has built a program that I feel really proud of and great about.
So what are some things that could, you know, if there is an organization, maybe they're thinking about taking a vet on for 2 days a week or, you know, one full day a week. What are some ways they can treat their vet that keeps them happy?
Oh boy.
I mean, yes, give them all the toys they need and tools to do their job, but
I talked about this before with Vince one time. In my opinion, and this is just my opinion, right? I can't speak for all veterinarians, but for me personally, and for a lot of other vets I know, burnout is extremely high in this profession. And it is not because of the animals or the medicine or the surgery or the euthanasia rates. It's because of the people and the lack of understanding and appreciation for what we do. You know, like so many people think vets are in it for the money. We are not. We are drowning in student loan debt and we couldn't care less what we make. We just want to help animals, right? And so organizations that allow veterinarians to practice medicine the way it should be practiced. I mean, that is it. Sure. And that doesn't mean that you have to spend $10,000 on every animal. It doesn't mean if you can do it, you have to do it. Right. I love it. I pick up relief shifts and I love it. All people come in and say, I have $311, like right off the bat, this is what I have. I can't come up with anything else. I want to do the best thing I can. Please use your expertise and you decide exactly what tests you run and what medications you send me home with. And sometimes you go, man, the prognosis for this disease it's off the charts. And I can tell just by listening to your cat or palpating this tumor that we're not going to solve the problem for $311. It doesn't mean you have to spend everything, but being realistic too.
Sure.
Another huge problem is a lot of animal rescues will be like, we want you to fix this and we want you to fix it for $100. And if you don't fix it, it's your fault. And then they badmouth a vet. Like I spent this much money and it still didn't get fixed. And the reality of animal rescue is a lot of these animals aren't fixable. And a lot of them really should have been given the comfort and dignity of the last act of kindness way before they got to a rescue. Rescues need to not be afraid to talk about euthanasia. It's a gift. Euthanasia is a gift that we can give animals.
It's either because everything will die.
Yeah.
And the option is euthanasia or a pasture death. And pasture death in horses, I've never seen one. I take that back. I did see one. I think she had a stroke and we went out there one day and this horse is just dead.
Yeah.
It's like, well, that looks peaceful.
Yeah.
Most of the time though, it's not peaceful.
So this is a little piece of my history that's relevant to this conversation that a lot of people don't know. So I was really interested in medicine and wasn't sure what kind of medicine. And my husband and I lived in Uganda and I volunteered at a human hospital while we were there. And I went from being really not anti-euthanasia, but like my childhood dog died in her bed at home, and in hindsight, I feel kind of awful about that. She had osteosarcoma, but at the time, that's what my family felt was the right thing. Like I went from being like, this is really horrible. Let's not talk about it. And I spent almost a whole year watching people die. Like this hospital, I will not name it. It was a horrible place to go. And my two big parameters for end of life are comfort and dignity. I want to be able to keep you comfortable and I want you to maintain some dignity. And you might say, my dog has no dignity. And sometimes that's true. But if you're urinating on yourself or can't get up and move, that's not dignity. That's not enough quality of life. And I watched human beings time after time after time be in agony and lose all of their dignity and end of life. And I was like, this is awful. And I don't want to be a human doctor because I have I believe in the sanctity of human life.
Right.
And I was like, not going into human medicine because I'm not going there. Right.
Yeah.
But I came back and I started working in an animal hospital and I was like, this is a gift, like it's not always the right choice. We don't ever want to make it prematurely. But I think if you could ask that sweet old horse who's 35 and a skeleton, hey, do you want us to keep you around for another 2 years, hobbling around, or are you ready to go? I mean, animals don't experience regret at the end of their life. And all of the ones that I've lost, there's so much peace and understanding and acceptance of what's happening.
And they also don't miss what they didn't get to experience.
Yes. That's a very human emotion, right? Like when we think, but only if, we had a gorgeous 3-year-old gelding come in through our last buyout with just absolutely nothing we could do injuries. And he was a happy boy. He got some pain meds and he ate a giant bucket of treats, which I probably shouldn't have given him that many, but, and he didn't we went, this is devastating. This horse was only 3 years old. Like I felt that this day, what an absolute horrible thing to allow to happen to this young horse. He had no idea, he didn't know that he missed out on 25 years of life. And we can go, this is wrong and we should change it. But those animals aren't going, wait, I'm only 3,
Right. No, for real. And I think that's where a lot of people maybe don't quite understand is animals live now.
Yeah. They're very much in the present.
Yes, they do have memories of the past. They don't have future anticipation of the future.
Yeah, so, I think that's true.
Other than maybe waiting for us to get home.
Yeah, they definitely know schedules. And working with elephants, a highly, highly intelligent species with decades-long memories, I do think animals communicate very effectively. And I also think that what I just said is true for any species. They're very much in the present moment. And I think we could learn a lot from animals from being that way.
So over in the vet hospital, do y'all hear the adoption bell ring when it rings?
Yeah, we do.
Good.
Yeah.
Because that's always like the best day.
I know I'm like never here for the adoption appointments unless they're like, we want to actually see the radiographs on this horse. And then I get to talk to people about it.
That's too bad. Well, if you don't have anything else to add, we're going to go ahead and wrap up. But thank you so much for joining us. And we'll see you guys next time on Horse Plus Podcast.